Imagine this. You're in your favorite first year chemistry lecture. The teacher waltzes in, the one everyone is nuts about. All around the lecture theatre, hearts are beating faster. This includes yours. Your chest hurts. You feel so incredibly faint, tired, fatigued, and short of breath. Dizzy and confused too, and not just because you don't get the content. Turns out this isn't the result of some creepy infatuation. You actually have an abnormal heart rhythm, also known as a cardiac arrhythmia. But what exactly is this? So let's say this is your heart. It is made of two main types of cells, contractile muscle cells and the cardiac pacemaker cells. These pacemaker cells are aptly named as they generate and coordinate the electrical activity of your heart. The primary pacemaker is the sinoatrial node, or SA node, and further down the electrical conduction system is the atrioventricular, or AV node. The electrical signals are generated and conducted through this system by means of action potentials, which spread onto surrounding contractile tissues through gap junctions to coordinate the contraction of your heart. Now let's take a closer look at an individual pacemaker cell. These action potentials are generated from sodium and calcium influx and potassium ion efflux through specific membrane channels. When you have a normal heartbeat, known as a sinus rhythm, the SA node sodium ions spontaneously flow inside the cell and make the membrane potential less negative. This phenomenon is known as depolarization, and it is associated with a mechanical event, like muscle contraction. This node shows the highest intrinsic rate, meaning it sets the magnitude and duration of action potentials. But this system can go wrong. Sometimes the electrical conduction system can't coordinate the rate and rhythm of your heart, and this is what's known as a cardiac arrhythmia. This may be triggered by excessive alcohol consumption, high blood pressure, known as hypertension, neurohormonal dysfunction, old age, genetic causes, just to name a few. Comparing this to a healthy heartbeat, we can see how the heart of someone with an arrhythmia differs. This can happen when the SA node malfunctions, no longer serves as the primary pacemaker, the impulse transmits abnormally, or impulses are generated randomly within the heart. When electrical signal changes, heart rhythm does too. Depending on the cause, there are different types of arrhythmias. The most common is atrial fibrillation. This happens when the atria, the upper two chambers of the heart, produce abnormal electrical signals, appearing almost to quiver or twitch in an uncoordinated way. This is known as fibrillation. Your heart rhythm will be fast and irregular, between 150 to 300 beats per minute, when normally it should be between 60 and 100. Although having an elevated heart rate is normal, when it beats this fast, the heart cannot properly fill to efficiently deliver blood to the body, thus starving tissues and organs of oxygen. And when your heart is starved of oxygen, this condition is known as angina. You might feel pressure or chest pain, like someone is literally squeezing your chest. Additionally, if this chaotic rhythm continues, blood can pool and form clots in the heart chamber. This can dislodge and travel to the brain with the potential to cause a stroke. Luckily, there's a remedy for this: antiarrhythmic drugs. These are the most common form of treatment as they are non-invasive and have a wide diversity of targets by modulating ion channels and receptors. There are four main classes of drugs that affect the action potential of cardiac cells, but today we will turn our attention to class 4 drugs which target and block calcium channels. These are often the drugs of choice as they rapidly provide rate control of the heart. Alternatively, perhaps you have high blood pressure or angina, which are often associated with atrial fibrillation, because then you're in luck because calcium channel blockers can also be used to treat these disorders, and I will explore how a bit later. Commonly prescribed for atrial fibrillation is Verapamil, a calcium channel blocker. This medication works to slow heart rate and reduce the strength of contractions. In an acute or emergency setting, 0.075 to 0.15 milligrams per kilo of body weight is delivered intravenously over a period of 2 minutes. So if say your patient was 70 kilos, 10.5 milligrams will be administered. And if required, a second dose of 10 milligrams is administered 15 to 30 minutes later. Because of Verapamil's short half-life when directly injected into your blood circulation, half-life specifying how long the drug persists in your blood after taking it, this means rapid drug intake and metabolism, allowing its effects to happen very quickly. It can also be administered orally, available as prescription medication for patients with chronic arrhythmias at a dosage of 120 to 540 milligrams a day. However, orally ingested verapamil has lower bioavailability and takes longer to exert its effects. As the drug class suggests, it primarily targets and blocks voltage-gated L-type calcium channels which are expressed in peripheral smooth muscle cells which form blood vessels, cardiac cells, and pacemaker cells. Let's start with its effects on blood vessels. See, when calcium enters muscle, it causes its constriction. Conversely, when we inhibit influx with verapamil, we will see the relaxation of smooth muscles and the dilation of blood vessels. As you can expect, this reduces the resistance exerted on the walls of the blood vessels and thus reduces arterial blood pressure, and this is how verapamil treats high blood pressure. Additionally, verapamil is noted to have the most efficacy on cardiac tissue to slow the rapid heart rate caused by atrial fibrillation. So when we block calcium influx through L-type calcium channels, action potentials normally generated by the influx of these positively charged ions is depressed. If we look at the membrane potential of pacemaker cells relative to time, we can see what is happening. We can see with a decreased conductance of calcium ions in cardiac tissues, this slows action potentials in nodal cells. As verapamil affects SA node discharge, it slows the rate of automaticity, or in layman's terms, it slows down your heartbeat. Verapamil is also particularly important in the AV node I mentioned earlier. This is as after an action potential is generated, it will take longer for the membrane potential to decrease and return to its resting state. This phenomenon is known as repolarization. As expected, AV node conduction will be prolonged, and this slows conduction velocity. This directly denotes a longer time for the depolarization of the atria. Both these effects on nodal cells in the heart decrease the frequency and the strength of contractions. Once heart rate is under control, oxygen delivery to the heart is markedly improved. This is as a slower heart rate decreases the heart's requirements for oxygen. Additionally, both this slowed heart rate and the delay of signal propagation through the AV node allow blood to properly fill the lower two heart chambers, the ventricles, which will then contract to provide blood supply to the body. But of course, like most drugs, there are caveats for its use. You see, calcium channel blockers aren't a cure-all. Although it prevents the dangerously elevated heart rate caused by fibrillation, it does not produce a sinus rhythm. And it is only after atrial fibrillation is stabilized that the conversion to sinus rhythm is undertaken. And this depends on the individual patient and may entail additional antiarrhythmic drugs, pacemaker devices, or even surgery. Because of verapamil's hypotensive effects, prolonged use is not recommended as it may cause your blood pressure to drop to dangerously low levels. Hypertension, heart block, and heart failure can be a side effect of verapamil. So if you have low blood pressure, congestive heart failure, or existing heart block, this medication is unsafe for you. It also interacts strongly with several medications, including those used to treat blood pressure, heart rhythm, and even some antibiotics, so definitely tell your doctor about any other medications you may be taking. Verapamil is also unsafe for patients with muscle disease, pulmonary edema, kidney or liver problems, and for infants under 1 year of age, as these factors change how the drug is processed in the body. If none of these factors apply to you, verapamil is safe to take. You might also be worried if you're a nursing mother, as it can cross into the breast milk, and low levels have been accordingly detected in infants. But not to worry, as adverse effects have yet to be reported. You might also want to think about what you're drinking, as both alcohol and grapefruit juice interact and increase the effects of the drug in the body, so should be avoided. To sum things up, antiarrhythmic drugs attempt to remedy rhythm disturbance and aid in restoring and maintaining a sinus rhythm. Suppressing increased automaticity and conduction speed are main mechanisms by which this is possible. Here I've created a helpful overview of verapamil that we've covered in this video. So next time your heart skips a beat in a lecture, remember never to mistake love for a cardiac arrhythmia. Here on out though, you can happily enjoy the remainder of that chemistry lecture.